I've started my week. Welcome everyone, and I hope you are taking very good care of yourself. Just on my way here, a very good friend of mine called and said she's down with COVID. My darling, sometimes we think it is over. It is not. Let's take good care of ourselves. Let there be social distancing. Let's wear our masks. Let's use our sanitizers. Let's wash our hands. Let's eat well. There's so much you can eat. And then let's take a lot of water. And I think I'm prophesying to myself. And I'm talking to myself that I need to take water. At least today, I have water by my side. Anytime I do a test, I go for my physicals, they tell me my water intake is so low. I think this week I've started having a water therapy. So please join me. Let's have the therapy together. I want to give a shout to Lady Deacon Beta Deborah, mother of Pastor Mawunyo and Pastor Esinu. Last week, she sent me a message and she said, Mama Rita, I like the way you look. I love your hair. I love your makeup. And you are looking so good and you are looking so young. Mama Beta, thank you so much. It's because of women like you. That is why I like to keep up. If I don't keep up, old ladies like you will take over. So please, thank you so much. And I know you are watching. Keep doing the good thing and keep praying for us that we will do better than we are doing. Last week, or for some weeks now, we've been doing and handling sex in marriage. Sex in marriage. I'm not saying just ordinary sex. We are talking about sex in marriage. And last week, we looked at the subject or the topic, painful sex. And I brought a couple to talk about what they've been through. My darling, ignorance is a killer. Because they didn't know exactly what they were going through. For 2.5 years, close to 3 years, they never had sex because it was so painful and there was just no penetration. Thanks to knowledge, they got knowledge somewhere. And I promise you that today I was going to bring doctors. Please let your questions flow. Any questions you have for the doctors, don't wait and let them go, please. I don't want to advertise my ignorance. I didn't go to a medical school. So any question pertaining to painful sex or any medical issues pertaining to sex, please let it flow now, and my doctors will answer you. My first doctor in the studio is Dr. Mrs. Carol Lajepo. Dr. Carol is a senior specialist at the Department of Obstetrics,
yes.
Obstetrics and Gynecology at the 37 Military Hospital, Accra. She's passionate about preventive health care with special interest in women's wellness, fertility, and clinical diagnosis. Dr. Carol is a certified member of the West African College of Surgeons, duly registered by Medical and Dental Council. Please listen. Duly registered. Before you go to any doctor, be sure. Just yesterday, somebody sent me something on WhatsApp. Oh my God. Somebody who said he's a doctor went to Kolebu Medical School and then trained in China. Later on, when he was asked, he said, oh, he actually did physiotherapy. Later on, when they went to Kolebu and they checked, oh my God, he's nowhere near Kolebu, nowhere near Kolebu. My darling, nowhere near Kolebu, nowhere near Kolegono. Meanwhile, he's working as a medical doctor, opened his own practice, and sleeping with the women around. My darling, please shine your eyes. The one with me here is a proper medical doctor. She didn't buy it. She went to school. And a member of Ghana Medical Association in good standing. She loves to give back through preventive health seminars. And I've told her we'll be doing business because I have a lot of women that we need to attend to. And screening services offered by the Health Advice Foundation, an NGO that focuses on providing general and productive health care. Information to help women make informed and safe choices. Dr. Carol, as she is affectionately called by her patients, believes that serving as a medical professional to save another human being is a great privilege and honor. She resides in the city of Accra with her husband and their children. Dr. Carol, welcome to the studios of Powerline TV and to Family Life with Mama Rita.
Thank you, Mama Rita.
I have two doctors today, so please let your questions come. One other doctor, she's been with us before when we were talking about domestic violence. Dr. Vanessa Appiah. We read a long profile about her when we were doing domestic violence. Today, her profile will be much shorter. Dr. Vanessa Appiah is a consultant in sexual and reproductive health and HIV, specializes in women's health, delivers clinics for sexually transmitted infections, sexual wellness and sexual problems, menstrual problems, contraception, and menopause. Dr. Vanessa Appiah is joining us all the way from the UK. Dr. Vanessa, welcome. I miss you. The last time we had you was on domestic violence, and it was so good. And my people have been asking when you are bringing Dr. Vanessa back, and I'm glad you are with us today. So welcome, doctors.
Thank you very much.
Welcome, Dr. Vanessa, and welcome, Dr. Carol. Dr. Vanessa is my doctor in the UK. Anytime I have issues, hey, I don't make her sleep. So Dr. Vanessa, thank you for being with us. And now my newfound doctor is Dr. Carol. And Dr. Carol Asante, if you are listening to me from home, please, I have another Dr. Carol here. I'm surrounded by doctors all over. That is why I don't get sick. They help me do preventive cure. My darling, preventive is always better. Preventive means that you work towards it before the sickness comes. Dr. Carol, I want to start with you.
Yes, Mama.
You are welcome.
Thank you very much, Mama Rita.
We've been talking about painful sex since last week.
Okay.
If we talk about painful sex or pain through sex, what exactly are we talking about?
Thank you, Mama Rita. In fact, when I watched last week's episode, it was very interesting.
Okay.
And it's a good thing you're doing. I will encourage you to continue. I will be supporting you.
Thank you.
To let the program run.
Thank you.
When we mentioned painful sex, last week you tried to mention the
names.
term.
And I told you I didn't go to medical school with you. So now the guru herself is here, or the gurus themselves are here. Please pardon me if I advertised my ignorance last week. I was only trying to help. Today, those who have the certificates, the proper certificates, not the bought one from China, they are here and they will help us. So, Dr. Carol.
Yes.
So you said last week I tried.
Yes, you tried.
Uh-huh.
But when we say painful sex, the medical term is dyspareunia.
Dyspareunia.
Yes, that's the medical term.
I tried mentioning it last week.
You really tried.
I tried. Please clap for me.
And actually, there are many causes. And before I even go into it, let's look at how God beautifully put us together.
That's right.
Because I remember the panelists were saying, go to the middle side.
That's right.
So when you look at the female anatomy, where the hair is, we call it the mons pubis.
Okay.
And so when the legs are parted, you will see the clitoris, you will see the opening of the urethra where the urine goes through.
Okay.
And then the next you come to the vagina.
Okay.
You come to what we call the perineal body. That's a hard place between the vagina itself and then the inner opening.
Okay.
Okay. So when you look at how beautifully God put us together, looking further down, the two big folds, we call them the labia majora.
Okay.
And when you come inner, you see the labia minora, the two folds that close the entrance of the vagina when the legs are together. Then from there, you come down to the vagina opening itself, which we call the introitus. And this is how God beautifully put us together.
Wow, I like that. He beautifully put us together.
And those organs all have a role to play during sex. And if there is any issue with any of the organs, then they can call dyspareunia. And dyspareunia, when we are looking at the causes, maybe from lubrication point. Maybe the lady has a problem getting wet.
Okay.
And this is where foreplay comes in, as you mentioned. Unfortunately, most of our gentlemen fall short in that area. But it's good we are teaching and they are learning.
That's right.
Exactly. So when there's problem with lubrication, maybe the lady has problem with estrogen production. Estrogen is low. For those of us in our 40s and beyond, estrogen is low. So lubrication is not up there and it can make sex painful. Or the lady is breastfeeding or has had maybe a surgical procedure around the area, like maybe she has given birth, so she's had episiotomy before she gave birth, the cut to enlarge the opening for the baby's head to come out, and so she's having pain. This type of pain we term as a superficial dyspareunia, that is surface. Surface.
Okay.
Or maybe if she even has an infection, what we call vaginitis. Usually most people will term it as white. That is where there is itchiness and sometimes it becomes burning. The place is red and it comes with discharge of various types. I'm sure Dr. Vanessa will go into the STI form of it. And so with this, what superficial dyspareunia comes into play here. And we also have the deep one. The deep one comes with the penetration. And with the penetration, if maybe there is a growth somewhere around the entrance of the vagina, it can cause pain. Also, when there is infection in the bladder, like a urinary tract infection, the woman may get deep dyspareunia, or when there's a growth like a fibroid, an ovarian cyst, or there is a situation where she's had what we call scarring. Maybe
it means I didn't do too badly last week.
Yes, you did very well.
I'm marking myself.
When there's scarring around the area, maybe the person has gone through chemotherapy, and then the person the lady may experience what we call deep dyspareunia. But much of it is also psychological. That's why we say that the biggest organ you bring to your marital bed is your mind. The mind controls the body. That's the way we put it. So once you psychologically prepared, you'll be able to have a good sexual relationship with your partner. So in a nutshell, this is dyspareunia. I'm sure we'll be touching more on that. Some more areas.
Dr. Carol, hey, yes. Dr. Vanessa, what would you want to add to it?
No, well, Dr. Carol has said it so well. I think that we'll go through some of the questions later, but it's the thing about pain is that we all experience it in different ways, and it may be on the outer side that when the man is trying to penetrate, it's hard, it feels, it's a burning pain, or it can feel really sharp, and then, or it can be as he's entered, but as Dr. Carol said, deep inside, because at our womb, the neck of our womb is something called the cervix, and sometimes if the penis, when the penis hits that, that can cause pain. So sometimes when you get pain in different positions, because the penis is hitting the cervix there, so it can be as they go in and then further in as well.
Okay. Dr. Carol, last week I had a couple here.
Yes, ma'am.
They went through this for 3 years. They saw me as a counselor, and the best I could do was to refer them to a hospital. I will mention the hospital. I think they went to about 2 hospitals. And surprising enough, it wasn't, they couldn't diagnose what the problem was. Is it that's common, or this has to do with certain doctors? I mean, how come they went through that pain for 3 years when they were going to the hospital? The name is
vaginismus.
Vaginismus. How come? The first clinic they went to, I can't remember what exactly they did, but the second place they went to was to break the hymen, and even with that, they had to put her under general anesthesia and all that. But after then, it didn't work, and it's like the doctors just didn't know what to do.
When it comes to sexual dysfunction and the diagnosis, you need a doctor that will go systematically through the way we arrive at our diagnosis. And especially if the person is a gynecologist, they are going to go through the various stages. And in fact, it's not easy for us to come to the diagnosis, because sometimes per our nature, because of our culture and how we are raised, usually the couple may not be able to tell you what actually the problem is and the reason for which they are there. But you, through your training, will be able to tease it out of them, and finally they will be able to tell you this is the problem. So you really need a doctor with a good listening ear to listen to you.
I like that, a good listening ear.
Go through the processes, and then you build a relationship with the doctor, and further on, you see the lady will be opening up, or the couple will be opening up, and then they will tell you their problem, and you can help them out.
So, my darling, if you are listening to us, you need, I like what Dr. Carol said, you need a very good doctor with a listening ear. I think the problem, not with all our doctors, but some of our doctors, is that they don't listen, they are not patient enough. They have too many patients they are caring for. So I think when you go, they don't really have time for you. With a couple I handled last week, I mean, they could have easily gone through divorce. Because for 3 years, I mean, there was no penetration. Dr. Vanessa, what do you think the problem was? For 3 years, there was no penetration. It was so unbearable, there couldn't just be penetration.
So this is really good to talk about, because first of all, vaginismus is really common, and when it comes to sex, as Dr. Carol said, not everyone is comfortable talking about sex.
Okay.
And that includes your doctor as well. So that's why some of us gone into this specialty, because we feel it's important to have that listening ear, to be open, to be able to make people feel comfortable to talk about sex. But not all of us feel comfortable talking about sex. But one of the things about vaginismus is that it is common, and our vaginas, I always say, is one of the strongest muscles in the body.
Okay.
So this is a muscle strong, and also it is very stretchy as well.
Okay.
It is able to open and tolerate a baby coming through. So it is a very strong muscle. But vaginismus is when the muscles in the vagina, they spasm and they tighten.
Okay.
But the key thing is that it's not by choice, it's automatic.
Okay.
And our brains are so powerful. And so if you've tried to have sex and it's painful and he's tried to penetrate, your body feels, oh my gosh, it's painful. So your brain is like, okay, you know what? I don't want anything to come near my vagina again because it's going to cause pain. So because of that, the muscles instantly tighten. When the muscles tighten, when he tries to penetrate, it hurts even more.
Okay.
And that's when you get that burning sensation. So what happens with vaginismus is because your mind tells you this, so your muscles contract. Okay. As a couple, as a woman, you feel, okay, what is wrong with me? But you don't want to talk about it. You're anxious about it. The husband is getting frustrated. They want to be supportive, but they also have physical urges. So because of that, often what happens, instead of talking about it and working together, finding the right doctor, often people sit in shame. Okay. And they don't want to talk to anyone. Okay. So that's why it's so important for shows like this, Mama Rita, that we talk about it and we get it out in the open. That it is nothing to be ashamed about, but it's important to address. Okay.
Okay. So then I'm getting the feeling, Dr. Carol, that now what we are talking about is not just to do with the doctors, but I think now every marriage counselor needs to know the issues pertaining to sex, so that during premarital counseling, we could deal with these things and prepare the couples, especially the bride-to-be, prepare them, let them know the issues pertaining to sex, and then before the honeymoon, they would have already been ready and know how to deal with these issues.
Yes, very, very important, because even when it comes to the sexual response, it's not just orgasm. Okay. It goes through phases. Okay. The excitement phase, where the nipple becomes erect, as I want to say it, becomes erect, and then the vagina area becomes lubricated. That's the excitement phase. And then it comes to the plateau phase, and then the orgasm phase, where you have the whole womb and the pelvic structures contracting at about 0.8 seconds at a time. Wow. It's very, very forceful. And then gets to the resolution phase, where everything is over and the body will want to rest, and both will want to sleep and then take some rest. So it's important that during marriage counseling, we take the couple through these, so that the man will not feel as if the woman is denying him of his rights. I mean, we all have stories to tell.
Just last week, and I think you are the first one that brought it up. What's the name? Honeymoon?
Cystitis.
Honeymoon cystitis. Honeymoon cystitis. I tried to explain it a bit. Now, from the medical point of view, what is it? and then how do we deal with it?
Okay.
And I hope my marriage counselors are listening. These are things that we need to now have to add to our manual, premarital manual, because so many things, there's so much information that we actually need to know about it. So honeymoon cystitis. Wow.
So as you mentioned, right, it's a form of inflammation or infection that occurs in the bladder. And it's just due to the couple having sex, and then the thrusting that comes from the penis irritates the bladder. So the presentation, the lady will come to the clinic with typical urinary tract infection presentation. So she'll be talking about burning sensation when she's urinating. She's urinating frequently. She goes to the bathroom very often, and when she goes, only a little comes, and it's very, very unbearable to have sex. During that time, you see that you do all your laboratory investigations, and sometimes you will not pick any organism as the cause of the urinary tract infection symptoms. And it's very frustrating because the lady will be like, so what is wrong with me? I was all right until I got married. And the gentleman is also saying, well, you're denying me of my marital right. And so the communication issue that comes with this, the straining of the relationships, and you're like, oh, is this what this whole thing is about? I mean, I thought we were going to have some nice time together, and all of a sudden. So it is a real thing that comes because usually it happens to a couple who are having sex for the first time, in consummating their marriage, as we preach and we go by as Christians that you wait till marriage before you consummate it. And so because it's the first time and the thrusting, then the issue comes with this inflammation at the bladder. We manage it like the way we manage urinary tract infections, because some actually will have bacterial growth when you do culture it in the lab. And so we give some antibiotics. For others, we just ask, take a little rest, put warm water or hot water bottles around the lower abdomen, take a little rest, some few days.
A little rest. Do the men understand the little rest?
We'll have to talk to them.
Wow.
Yeah, so in a nutshell, this is honeymoon cystitis.
Wow.
And you need to be paying particular attention in order to pick this, because if you've treated the lady, she's gone twice and she's back and the problem is still like that, then you should be thinking that, oh, maybe it's not from an infective cause, and it could be that.
Wow. So this one just happens to people who are having sex for the first time?
Yes, those who are, usually those who married not long ago, and then they're having sex.
So for a doctor, I think you really need a listening ear to be able to know that this is not ordinary UTI or yeast infection.
Yes, or pelvic inflammatory disease.
Wow. 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 Dr. Vanessa, what is the therapy for painful sex? What do we do when we go through painful sex?
So the key thing about painful sex is that there is many different reasons to cause it. So the key thing is to go to have investigations for it. So it may be that there is an infection there. It may be that the skin is inflamed, and so you need to have like some steroid cream there to treat it. It may be that you need an ultrasound if it's further deep inside, because it could be fibroids. It could be things like endometriosis. So the key thing is that if you are experiencing pain, you need to go and speak to your doctor about it so that they can investigate and work with you to find out the reason.
Okay.
And one of the problems is that many people don't go and speak to anyone, so they live with the pain and the symptoms for a long time.
Okay.
And that shouldn't be the case.
Oh, wow. We will go on a commercial break and we'll be back. Please let your questions keep flowing. Dr. Vanessa is here, Dr. Carol is here. They are here to answer all your questions about painful sex or issues pertaining to medical, medical reasons why you are having any problem with sex. We'll be back and we'll answer your questions.
To catch God's attention. In a crowd of hundreds, blind Bartimaeus was singularly successful in catching the attention of Jesus. Similarly, there are many today seeking, just like blind Bartimaeus, to encounter Jesus but would fail. This book, How to Catch God's Attention, will unravel the mystery of the 5 key principles of prayer, covenant, faith, worship, and sacrifice that Bartimaeus applied for success. Rush for your copies now, and your life will never be the same. Order online on iBookstore, Amazon, Kindle, Barnes & Noble, or visit any major bookstore near you.
And we're standing here.
Welcome back to Family Life with Mama Rita. If you are just joining us, I have 2 wonderful doctors here, Dr. Carol and Dr. Vanessa, coming all the way from the UK. We are handling issues pertaining to painful sex. My darling, sex is not supposed to be painful. It's only painful the first few days or weeks when you are breaking your virginity. Apart from that, it's supposed to be an enjoyable one. If you've gotten to the place where you are not enjoying it and it's so painful, you need to seek medical help. Today with me, Family Life with Mama Rita, is Dr. Vanessa from the UK and Dr. Carol to help me solve your issues. Let your questions keep coming, and trust me, by the time we are done with Family Life today, every issue and everything you are going through with painful sex will be handled. So we will go to my co-hosts, Pastor Chief Apel.
Yes. Thank you, Mommy. Social media is buzzing with a lot of comments and questions. And you are welcome. Please follow Mama Rita on all social media platforms, Facebook, Twitter, Instagram, Mama Rita K, at Mama Rita K. You'll be able to follow her and be a part of every counseling and educative session that she is giving to the generation. We are also live on YouTube, Powerline TV. We are also on Facebook, Sam Crunchy Ankara, and then on your favorite digital channel, Powerline TV. Wherever you are across the globe, please keep your questions coming through, +233-200-515253. And Mommy, Daddy, as we have announced earlier, these episodes on sex are rated 18. So kindly give the kids some hotspot.
No, today I don't think we need R18 today.
Well, it will depend on the questions.
Anyway, the children need to learn some of the things we are knowing now. If we knew it as children and our teachers were teaching us, I believe that before we got into marriage, we'd have solved the issues before then.
Well,
it depends on the questions that they come in.
The ladies are interested. I'm sure the guys are watching football.
Yeah.
They are not serious. All right, so Mommy.
But they need to learn.
They need to learn.
So we'll go straight to our first question for the night. Quite an interesting one. This one says, good evening, Mommy.
Good evening.
God bless you for this very educative session.
Thank you.
Please, I had episiotomy during my first and second pregnancy or childbirth. But the first one took over 6 months for me to get healed. This affected my sexual relationship with my husband over that period. I still have some of my vaginal flesh hanging. I do not want this repeating or getting worse, and it makes me feel very uncomfortable. Can your doctors help? What can I do as far as this is concerned?
Dr. Carol.
Yes, Mom. Well, this is very real. I mean, episiotomy, as I explained, is a surgical procedure where we try to increase the outlets of the vagina so the baby's head can pass through. And unfortunately, when we finish and we put it together, sometimes there are issues, like she explained. It may not come together like it's supposed to. And sometimes in the healing process, you find out that there is what we call scarring. And because of the way it gets scarred, during entry, there is a problem because that side, because we've cut the, sorry I'm using the word cut, because of the way the procedure is done, usually lubrication is affected on that side. And also feeling, so you never have sexual enjoyment around that side.
Oh, wow.
And certain positions makes the pain worse. For this one, you need a lot of lubrication. And also the gentleman to be very gentle and know when the wife is ready to receive. I remember my anatomy lecturer saying you have to relax and receive. Know when she's ready to receive you. Otherwise, she's going to have a lot of pain. With the vaginal issue she's talking about, she says some vaginal flesh is hanging.
Yes, I think part of
Okay, so we have what we call vaginoplasty, where we do a form of plastic surgery to put it together beautifully. But if your husband is not complaining, I think you should be able to come along and feel free so that you can have a good sexual relation. But yes, we have plastic surgery for that, to put it beautifully together again. And even,
I need to come
I
need to come to you to see if my place is beautifully put together, or I must do plastic surgery.
Once Papa has not said anything.
Wow. Women go through a lot.
Yes, yes. And actually, in painful sex, women should know that you haven't done anything wrong. You are in pain, so don't feel guilty about the fact that you are the one causing it. And that one prevents some of the women from going out to talk about it. And it makes them very depressed. I'm sure Dr. Vanessa will stress
Dr. Vanessa,
more
would you want to add to this question? Would you want to add to it?
Yeah, I think we see it a lot. And I think that the lubrication is so important. But it's also, I think this is where communication with your partner about it, also foreplay, because as we said, that area, the sensation has changed. You may not get wet, so to be ready to receive, you have to prepare your body. And you want, and if you're looking at that area and you don't feel confident, sometimes you just don't feel a woman. So you need to work with your partner to enjoy each other, to touch each other, to find out the areas that you both enjoy, so that you become more confident and you think, right, I'm ready to enjoy this. And then that also contributes you into enjoying sex as well. But as we said, we all look at our bodies and think, okay, whether I like this bit and I don't like that bit. But if it's really causing you significant concern, again, go and see your doctor so they can look at it and see if having an operation is an option for you. But also, as we said, your partner it may not even be bothering them. So it can be key.
Feel free.
We will move to the second
All right,
question.
we'll feel free. But talk of the episiotomy. Are there instances where childbirth in itself, natural childbirth, without that procedure, can it also affect the sensation around the vaginal area and affect sex?
It does for a short period.
Okay.
But then the body regains it, and then you are fine. The body regains it. She could also be having this pain because she was breastfeeding. She had it for 6 months.
Yeah.
Yeah, it could be because she was breastfeeding. Breastfeeding means estrogen is low.
Okay.
Estrogen is a hormone that helps the vaginal area to be full. So it means that she was dry and they needed a lot more lubrication. We have lubricants that we use. And so, you know, during the pregnancy period, maybe the guy has held on all this while the wife has delivered and he must fire on all cylinders. So, and in fact, you have to... You have to be gentle during those times. And use a lot of lubrication.
Okay.
Yes, we have lubricants available.
Okay,
yes.
In the pharmacy shops.
Yes, not shea butter.
Not shea butter.
Yes, please.
Not Vaseline.
No, ma'am.
Not anointing oil.
No, ma'am.
Oh wow.
And yeah.
So what about shea butter we can use?
It's not a good lubricant.
Oh, okay.
Yes,
okay.
we want you to use water-based lubricants.
Oh, okay. Please stop using the shea butter, the nku. Stop using Vaseline. Stop using anointing oil. You are not doing deliverance down there.
Those of you using bodges.
Bodges.
Don't want to mention names.
Please go for water-soluble lubricants. I think water-based.
Yeah.
And you can get them in the pharmacy shops. Yeah. And I hear they are not expensive, my darling. Don't scare yourself.
Not at all. And even the filling stations, you get the water-based one. And they come in different flavors. Yeah.
Oh, wow.
Oh, yeah.
So you've been buying some?
Oh, I buy, Pa.
Oh, wow.
Pastor Papa directed me where to get it.
How nice.
He showed me some Shell filling station around the airport area.
Wow.
Pastor P, thank you for your counsel.
And then I'm old school. I didn't know the filling station sell these things.
Yeah.
Wow.
They come in different sizes.
Wow.
All right. We'll go to this next question. This one says, hello, Mommy. Good evening to you and your panel of doctors.
Good evening.
Please, I'm Lizzie from Kumasi.
Okay.
The last time I had sex with my husband, it was then we realized I had whites, that's candidiasis. And I am pregnant at the moment as well. This is something I haven't experienced before. It's making sexual encounter with my husband uncomfortable. Please help me out.
Dr. Vanessa, please.
So, yes, this is really common. So in pregnancy, some women may have had whites, or we sometimes call it thrush. You may have had it before, but in pregnancy, just because our immune systems are a bit lower, the vagina changes, that environment changes in pregnancy. So thrush is far more common. And when you do have thrush and you have the whites, it's not just the discharge and the white discharge. It's the skin around the entrance can become itchy and sore. So when he's trying to enter, it can be really painful, and you can get quite like a burning sensation. Sometimes in there can tear as well. So what we say is that there's good medication. There are pessaries. So there are little tablets that you can put inside the vagina, and that breaks and clears the whites for you as well. When you're pregnant, there are some tablets that you can buy over the counter. We don't advise you to use that in pregnancy. So we advise you to use the pessaries that you put into the vagina. There are some creams that you can put on the outside. So we call that there are different preparations out there, but it's an antifungal cream that you put on the outside to give you some comfort. But I always encourage women, when we have any discharge, etc., sometimes we tend to wash more, use soaps, bubble baths, Dettol, Femme Fresh, all these kind of vaginal washes. Please don't use those.
Okay.
Just use water in those areas, because what happens is that it makes your symptoms worse. And you often sometimes get more of a smelly discharge when you do that. All that discharge, bacterial vaginosis. So we advise not to do that. So please, advice to the lady is to get some pessaries that you can get it over the counter at pharmacies. Also at night, sleeping without your underwear. Try not to wear tight clothing because sometimes the heat there and the sweat.
So they should sleep without the underwear. Please say that.
That's the only thing you heard.
Very important. Sleep without the underwear. They didn't hear it. They were
Dr. Chief Ape just heard sleeping without your underwear. That's all he heard. Dr. Vanessa, please continue.
I'm saying it's not extra fun. It just lets air come around the area.
Okay.
So that is really important as well. But just to say, what typically happens, that it can happen quite regularly through the pregnancy, but generally once you deliver, that it improves.
Okay.
It's just to take precaution.
Okay. Dr. Carol.
Yes, to add a little bit to what Dr. Vanessa said. Actually, during pregnancy, the vaginal discharge increases. It's a normal thing because, as Dr. Vanessa mentioned, the entrance of the womb, where we call the cervix, sometimes it protrudes out in a way, and then there is irritation. So there is increased vaginal discharge.
Okay.
But you will see that one is not itchy.
Okay.
It doesn't have any peculiar smell.
Okay.
And the lady might think that, oh, I'm having white, I'm having a lot of discharge. When you report that, usually we will not give you any pessary or any medication against that, because it's a normal thing. Once you deliver, it's going to go away.
So, my darling, I think you heard Dr. Vanessa. She said when you are going through that, don't try to use things. Don't go and use soap to wash the place. Don't go and use Dettol. Don't go and use things. When you try to use these things, you rather worsen the situation. Just use water or warm water and you will be fine. You either go to the hospital or over-the-counter medications that will help solve the issue.
All right, this viewer says, God bless you, Mama Rita, for this powerful session.
Amen.
I've been married for almost 2 years, and any time I have sex with my husband, it's so painful. It hurts so bad that I hide in the bathroom crying.
Wow.
This has killed my urge for sex with him. There is no excitement looking forward to making love with my husband anymore. We've tried water-based lubricants like suggested, and it hasn't helped. Now we rely heavily on the oil-based ones. If he does apply them anyway, if he doesn't apply them, we are unable to have sex. Sometimes he gets so desperate, he adds saliva to this. Comment if this is also advisable. It's painful, Mommy. I don't know how long I can keep pretending in having sex with my husband.
Wow. Dr. Carol.
Yeah. I feel a pain, but then she should take the pretense aspect out of it. The man and the woman were naked and unashamed.
Yeah.
So she should be able to tell the husband that this is what I am going through, and then they should seek help.
Okay.
We have discussed many causes of painful sexual intercourse. Maybe it's got to do with her mind. Maybe she's not having enough lubrication because there's no foreplay. It's all at once, and then you have to receive because the husband is ready. Maybe there is a structural problem we can look at. So when we examine in the clinic, we'll be able to tell her if there is a problem that we can solve, a problem we can identify. So she should please approach her gynecologist and she'll get solution.
Okay. So please approach your gynecologist. Otherwise, if you are in Accra, you can call the offices of Royal House Chapel and we will link you up with Dr. Carol.
All right, we'll move on to the next one. This is an interesting one, Mommy. Says, good evening, Mama Rita. Please, I am also a marriage counselor, and I'm currently dealing with a client who has sexual issues with the husband. Please help me out with your doctors. Do people react to semen? My client currently gets swollen genitalia whenever semen gets into her. What could be the cause and what solution can be preferred? Thank you.
Dr. Vanessa, please.
So yes, I also, again, it can be so frustrating, so difficult for this to be a factor in your relationship. But I do see it, and I'm actually looking after a couple that are going through this. So, the different people experience it in different ways. But for this lady, you can, some women do experience when the semen touches the entrance of the vagina and the vulva, the lips there, it can sometimes cause a bit of an allergic reaction.
Wow.
And so this well and be quite painful. And for such women, again, it's really important that you go and speak to someone about it, go to your gynecologist. Because, for instance, the couple that I'm working with, we are using antihistamines, so things that you tablets for hay fever and use for allergic reactions. We are giving it to her, and she's now being able to enjoy sex, and she's not having this allergic reaction. So it is possible, but again, it's going to speak to your gynecologist to talk through it. Also, just to say that I've had other couples that have talked about it, and sometimes it's not actually the semen, it's the some of the other products that they are using within foreplay sex as well. Speak to the doctor. Be very honest about what you're using, everything. So whether it's saliva, whether it's shea butter, please let them know, because that will also help. Also, for some couples as well that has happened, sometimes it depends whether you're trying to have a baby, but for some couples, actually, if the man wears a condom, then actually then that kind of relieves the problem for a bit, but that's not a long-term problem. But emphasize all the time, it's about going to your gynecologist to talk through it, work with you. Don't sit there nervous thinking, gosh, what is it, what can I do? Nothing can be done. And also don't diagnose yourself, because you may, but it could be something else. So it's important to find the specific reason that's causing it.
Dr. Carol.
Yes, ma'am.
I'm sure you would want to add to it.
Yes, Dr. Vanessa has done a very good admonition to it. So,
So let me ask this question before the next question comes. In Ghana, can you just walk to any hospital to say, I'm looking for a gynecologist? Assuming I walk to the polyclinic, are there gynecologists in the polyclinic? Can I walk into any hospital and say, you know, we know outside the country people have gynae doctors, if I should put it that way. But here, for a long time, if you ask me who my doctor was, I didn't have a specific doctor. I walk into any hospital when I'm sick, and, you know, until recently when I started growing and started having pressure issues, then now I have one doctor that takes care of me. But it's not something with the, I don't know whether African or the Ghanaian. So for anybody going through this kind of problems, what is the way forward? What do you do? Do you go to walk into any hospital and say, this is my problem? Or you go straight and say, I want a gynecologist?
Thank you, Mama Rita. In fact, handling this particular issue, you need a gynecologist.
Okay.
But you may find yourself in the polyclinic.
Yeah.
At the polyclinic, they are usually general doctors.
Yeah.
But a doctor might be able to pick what the problem is and then give you a referral to see a gynecologist. And thankfully, there are quite a number of us practicing in Ghana.
Okay.
Those of us who are female are in the minority anyway, but then there are quite a number of us around. And I'm sure when you Google, you'll be able to find addresses of clinics that have gynecological services. The other issue has got to do with the privacy we provide during our consultation, because in the public settings, for instance, you have like 2 doctors consulting in the same office, so you usually may feel shy to actually open up. But if you go to a place where you are giving proper privacy, then you can open up, develop a relationship with your doctor, and then step by step. Sometimes even during the process, the client will call, and then you'll be going through the midnight calls with them together.
I see.
Yes.
Wow. Wow.
And so they can achieve a good result.
Wow. Wow.
Well, that's interesting. Keep your questions coming through. +2332005152553. This is Family Life Series, Sexy Marriage. You're talking to the doctors. And Mama Rita is facilitating this beautifully. We go straight to the next question. It says, good evening to you all in the studio. God
Good
bless
evening.
you for your hard work, Mama Rita. My problem is simple. Well, I mean, it doesn't look simple here. She says, my problem is simple. I always experience so much pain during sex, and I see blood every time after sex.
Wow.
Wow, blood after sex.
Yeah.
Yep.
There is actually a problem. And the problem may be coming from the cervix, the vagina area, or even the entrance. Actually, sometimes you can have fibroid going through the cervix, and every time the woman may have bleeding when she usually goes through sex with her husband. It could also be that she's growing. She didn't say her age.
No.
Usually after 40 going, when the hormones go down, the vagina is drier, and so because there's little lubrication, it breaks down easily, and so she can bleed. She can also feel pain, and we advise the lubrication and then the foreplay as well, and the use of steroids. We have some medications we give. And there are more serious problems with seeing blood after sex. It could be something as serious as cervical cancer. It may be presenting just as bleeding after sex. Or sometimes cancer of the uterus may just appear as such. And so it's best she sees her gynecologist for assessment. It's very important.
So, my darling, don't stay at home and self-medicate yourself. It could be anything. So please, if you continue to have painful sex and bleeding after sex, please see your gynecologist as early as possible. I don't know, I would not recommend just walking into any hospital. When you go, tell them you have a gynae problem and you are actually looking for a gynecologist. Because sometimes, like Dr. Carol said, when you go into our polyclinics, there isn't too much privacy. So it's difficult to, talk about such issues. So get a hospital that has a gynecologist, and then I believe they'll be able to attend to you.
Well, Mommy, sometimes the issue is in some of the hospitals, especially the small boy doctors, quote unquote. If you try to suggest to them you want to see a gynecologist, they will make you feel they are in the right position to deal with the issue. So they will either brush the person off. So it's tight, but we believe Dr. Carol will use her influence to carry a message across.
Thank you.
This message is a one-liner. Says, please help me. I always vomit during sex.
Wow.
We can't start in the jail for them.
Wow, people have issues.
Dr.
Vanessa, somebody throws up every time she has sex.
You know what? I'm laughing, but I've actually had a patient like that before, and it's really interesting because they were vomiting because they were in so much pain.
Okay.
And then they were nervous about having sex, and so because of that, they would vomit. So I would think whenever we think about vomiting, you know, you're always going to think, is there something in the stomach, in the gut that is causing it? So again, you must go and speak to someone.
Okay.
But for me, when anyone talks about anything like this related to sex, I always like to really just take a step back and really understand, are you really vomiting, or are you using that as something to tell me there's something else is going on? And all know that you shouldn't be vomiting around sex. So what is happening? Is it pain? Is it nerves? Is it something else medical? But definitely go and speak to someone about it. But I just wanted to highlight that the patient that I saw that was vomiting due to sex with the pain and fear, just to remind everyone, because obviously that's why we're here. The experiencing pain and the concern around sex is really, really common. So you are not alone. The questions that we today, for all the different reasons, whether it's episiotomy, whether they think it's white, whether bleeding after sex, problems with our vagina are really common. And so you are not, but again, go the help.
Dr. Carol, would you want to add to it?
Well said,
vomiting after.
Yes.
Could it also be that the person is too full?
Yeah, possible.
Because I always tell my husband, when you want to have it, let me know early enough, so I don't take too much water, I don't get too full.
Marita, you have to be spontaneous sometimes.
Yes, I know, but when I'm too full, I feel so uncomfortable. Or I drink a bottle or a glass of water. Oh, when he lies on me, it can be so uncomfortable. I know sometimes you need to be spontaneous, but then if you are uncomfortable, then it means that the style would have to change.
Exactly.
Well, we are in phone come on. This one says,
I don't know whether that has to do with age too.
Well, the doctors will answer. This one says, good evening, Mama Rita.
Good evening, my darling.
After I had episiotomy, there was an infection.
Okay.
Since the cut also took so long to heal, I had to undergo hysterectomy. Today, dear. I feel so much pain around the area where I had the surgery, and it's been 2 years since, and all forms of medication haven't helped. It's currently affecting my waist and even makes walking very difficult.
Wow.
What can you help with this problem?
Wow. Dr.
Okay,
Carol.
so when I had the hysterectomy bit, means she had surgery where the uterus was removed.
Oh, okay.
And adhesions or scarring is one of the causes of painful sex.
Okay.
So it could be that the scarring which comes about because of the normal healing process is what is causing her to have this pain. She will need help from all areas. It may be a multidisciplinary approach, because we will need a psychologist to come in, a physiotherapist, where she will be taught how to relax the pelvic muscles.
Wow.
And that is why you must go to a certified health practitioner.
Please listen to Dr. Carol well. Dr. Carol, please say it again.
You have to go to a certified health practitioner, please. If you go to shady places, you just see the way the setup is. Please flee.
Yeah. And this guy I watched claims he does physio. So in the physio, he's trying to, massage, and he claims he has to relax you. By the time you realize, he's put his whole fingers there. So please be sure of where you are going to. Don't just go anywhere because somebody recommended you. Find out from the person when you went there, what did you go through? Talk to other people about it.
All right, this one says, good evening, Mama Rita.
Good evening, my darling.
I had issues with painful sex, I've had issues with painful sex. And I've been advised to use vaginal dilators to stretch my vagina to make it easier to receive my husband. Please ask your doctors if this is advisable.
Dr. Vanessa, please.
So yes, it is advisable. So with the muscle there and with our pelvic muscles, sometimes we need to retrain it. We need to let the muscle know that it can tolerate the penis. And sometimes the thought of you've tried to have sex and it's been really painful. I said earlier, your brain tells you it is too painful. I can't tolerate that size. I tense up. So what we do, that the work that I do with it is, first of all, is in terms of breathing exercises. So I always say to women, sometimes you can lie down on the bed, lie flat, you can put your hands on your tummy, and you can just concentrate on doing really deep breathing. And breathing is really important because then your brain concentrates on something else, and then that lets muscles relax. So for some women, the breathing makes such a difference. And then what is that there are a set of dilators. I wish I had them here to show, but they are we have them in different sizes. So the first one, almost the size of my finger here. And it has a little handle. And what you do, put lubrication on it. And then you touch the entrance of your vagina. And so what that does is that it tells the muscles there that something is coming. It trains the muscles. It sensitizes. You've got nerve fibers there. And the dilator, it just tells the muscle there that it can tolerate that size. And then you pass the dilator in, and then your body is okay, I'm able to tolerate it. Your brain that it's safe. That gradually with time you keep on using the different dilators, and they increase size. So then ultimately you come to the largest dilator, which is about the size of the penis. And so you are able to then train your muscles to then accept the size of a penis. And then we go from that to just encouraging you to have foreplay, enjoy your partner, and then hopefully with lubrication, the breathing, retrains the muscles, you'll be able to have penetrative sex with your husband. So it is something that I use regularly with women to help them. These are women that have vaginismus, so their muscles have tightened, they experience burning sensation, they've been unable to have tolerate the penis. So we try breathing, we try lubrication, and we try the dilators as well.
That's great. That's great.
Caution. Go to a registered health professional to work through that with you. Because it's intimate, it is something that you gradually gain confidence, and you need to have the right professional to guide you through that. But once you find the right professional, it can be transformative.
Wow.
So don't shy away with the right professional.
So please, you need the right professional to go through this with you. Don't go to any quack doctor for them to try things there, try their fingers and try all sorts of things. By the time you realize from the fingers to they entering into you themselves. So please go to the right doctor. Dr. Carol, do you want to add to it?
Yes, and so we are saying that using the dilators is very good. Go ahead with your doctor's advice. But also, in addition to the breathing exercises Dr. Vanessa mentioned, the psychologist will help you to overcome that fear that makes the vagina muscles contract involuntarily. Although you want to give in, that fear, they will take you through a process where you let go of whatever fear it is, together with prayers, I will add, and then you overcome the problem, and the couple will have good intercourse.
So, doctor, would you advise then, as a pre-marital counselor, that virgins going into marriages should try with dilators, and does it have the risk of breaking a hymen? This is a question that has just come in.
Yes, it has the risk of breaking a hymen, and you have to wait to consummate and consume. How do you say, Mama Rita? You have to consummate the marriage.
That's right.
Before you go ahead and find out if there's any problem.
Okay.
So there might even be no problem at all.
There might be. Mostly there's no problem.
And then please, all of you, stay put.
So please relax. Marry first.
Marry first.
Go through your first night and then your honeymoon. Then we will know if you have an issue or not. Dr. Carol is always there. Dr. Vanessa is always there to help you.
All right, we'll take our next question. But we've heard about cystitis.
Yes.
But we have bronchitis during honeymoon. All right, this one says, good evening, Mommy.
Good evening.
I would like to know, I'm currently pregnant and I still see my menstruation every month. What could be the cause and how do I address this?
Dr. Carol.
All right. So it is not normal to see your menstruation when you are pregnant.
Okay.
And seeing that, it's most likely the pregnancy wants to miscarry.
Okay.
Most likely she's experiencing what we call threatened miscarriage. The pregnancy wants to miscarry. So you need to see your gynecologist. I'm sure a scan will be ordered to find out whether the cervix is opened or not, and also examine you from the vagina area to look at the cervix. You're not supposed to have your menstruation during pregnancy. And most likely, it can also be pointing to something dangerous like ectopic pregnancy, where you may think you are pregnant, the pregnancy is not at the right place, and so the woman will be bleeding slightly and may think that she's having a normal menses. In fact, that same ectopic pregnancy may even cause dyspareunia, that is painful sexual intercourse.
All right, this one also says, good evening, Mama Rita.
Good evening.
You're looking awesome tonight.
Thank you.
My name is Doris from Saboba.
Okay.
My question is, anytime my husband plays with my vagina ahead of sex, so I mean foreplay, I easily get feelings. However, as soon as I experience these feelings, comes lower abdominal pains. What could be the cause? So this one is not even penetrative sex. Just the foreplay, she gets the excitement, and then next is an abdominal pain.
Dr. Vanessa, please.
So that again, that is common. One of the things when we are in foreplay, there's a cycle of arousal that we go through in terms of going from, as was mentioned earlier, from touching their nipple, and that gets erect. Your heartbeat goes faster. You become a bit sweatier. You then become you get wet as well. But one of the things as well is that one of the hormones that is released in that is oxytocin.
Okay.
And that is a hormone that can act on your uterus.
Okay.
And that can sometimes cause contractions there. And so in that whole excitement, sometimes when you feel that you're feeling a lower discomfort when you're in foreplay, that can actually be that hormone acting on your uterus and is contracting, and it can cause that discomfort. So that is one thing. But I always say with this is that it is always important to go and speak to someone about it, because it may be that you're enjoying sex and you're enjoying foreplay and you're getting a discomfort, but there may be another cause for that discomfort that isn't this. It may be. So it's important to go and get investigated to make sure that there is no infection there. We haven't talked about sexually transmitted infections, but it's important to exclude infections. And then it is also important that it may be that there's something higher up, like a fibroid, like a cyst, etc. When you're contracting, it brings more awareness to that area and causes pain. So you can get pain and a weird sensation during foreplay there, but do go and speak to your doctor for it to be investigated, just to make sure that there's nothing else that is underneath all of that could be that pain more. And Mummy, do you mind? I just wanted to mention something what we've been talking about in terms of when we were talking about the dilators and the psychologists. There's something that we haven't really touched on is one of the causes that some women have in terms of that fear and anxiety about sex is because they may have had an episode before that they did not consent to sex. They may have had an episode of sexual violence or something like that. And so that as well is so important to speak to the doctors, speak to the psychologist who can help you work through that. Again, you don't have to live with that fear, you don't have to live with that shame about it. And it's possible to work with the psychologist, to work with your gynecologist, so that you can go on to have an enjoyable sex life, because that's what you deserve. So,
Okay.
Very important.
So you are fine. We should move on to the next question.
All right. This one is another interesting one. I like the interesting ones. This one says, "Good evening, Mommy.
Good evening.
And a great job with your doctors."
Okay.
Says, "Please, I love doggy style with my husband. However, anytime we have doggy style, I feel so much pain. What can I do about this?" You like it?
Change your style.
Doctor,
Change your
she
style.
says she likes it.
You like it and it's so uncomfortable and you are in so much pain.
Change your style.
There are so many styles. Doctor, please tell them.
Yeah, I'm saying that change your style so you can be comfortable.
Yeah, even the doggy, there's a way you can position it so you don't feel
Exactly.
too much crash.
There are many ways.
Mommy. When we do our next couples all night.
Yeah.
Well, change the style, and if you have to even do bodily movements in a way that makes it a bit more comfortable,
That's right.
kindly adopt all angles. You can use compass to look at the angles, obtuse, acute, whichever works for you. All right.
The
Mommy.
next time you be the one.
This question says, "Good evening, Mama Rita.
Good evening.
How long can a woman who has just delivered take to continue having sex? How long?" Yeah.
I know these questions come all the
Yes,
time.
yes,
They were questions I used to ask all the time when I was much younger.
Let me say, when the woman is comfortable.
Okay.
But you ask, when is that period? she needs at least 2 to 6 weeks
Okay.
to come out of the birthing trauma that she's been through. You know, it's so painful that sometimes when you go through potholes, you feel the pain when you just delivered. And so she needs to get well.
Okay.
The place needs to come together,
Okay.
and then you can have fun. But there are other ways of getting to enjoy each other without having penetrative sex. So you can employ such things so that at least you can enjoy each other. Sometimes the foreplay is enough to let you fall asleep and wake up refreshed the next day, because a lot of hormones are are released to just let you keep calm and sleep well. This is not to say that it's only in the night that we make love. I mean,
So you had it 2 to 6 weeks. 2 to 6 weeks. Otherwise, there are other forms of enjoying yourself. But what I don't know is for the men, when they go through the foreplay, they just can't hold it. They want penetration by all means.
well, that is true. But if you know your wife is recovering from childbirth, then you should be able to hold yourself, as you say that.
Okay.
Well, and I'm also told, I've learned that usually for freshly delivered women, the breasts are a bit full. So sometimes the men are able to use the breasts.
Yes, for non-penetrative sex.
Yeah. Mommy, so we go to the next question. This one, Pastor D told me.
Pastor D.
Pastor D. Brian.
I didn't know you have become a teacher.
IT manager.
IT manager.
Well, this question says, good evening, Mama Rita.
Good evening.
I'm listening from Nigeria.
Okay.
Great.
I have this question bothering me, and I really need your help. Anytime I have sex with my husband and he releases semen into me, I will keep polluting the air. That's flatulence.
People have issues.
Sorry, let me get serious. Says, I'll keep polluting the air until I use the toilet before it stops.
Wow.
Please, this is embarrassing me. What can I do?
Wow. Dr. Vanessa,
This one,
I
it has
haven't
to go
heard this
to
one
outside
before.
the country.
So there are some people that when they do have sex, they do release wind.
Okay.
And they can pollute the air, as has been described. And for some people, that is entirely normal.
Okay.
And the excitement of it as well. Your bowels are relaxed, etc. That can also happen as well. Sometimes some people feel that they have let wind go, but it's the secretions that have made a noise, and they think that they are farting, or what some people call it squelching through sex, etc. That can happen. But the other thing is that if the person is feeling uncomfortable or bloated, or other symptoms associated with it, that should definitely just be looked into. And it even be simple things like diet, what you're drinking, etc. All of those things can affect the bowel as well. But the farting and making those sounds and smells through sex, for some people, it can be something that happens quite a bit.
And this can be embarrassing.
Yes.
Yeah. No, definitely. And I always say that sometimes to get past the embarrassment, you need to own it and talk about it, because sometimes you're farting, you're thinking, did he smell it? Did something happen? Then you're getting nervous as well and uncomfortable. So if it's happening and it's happening regularly, then you need to talk about it, both with your doctor, also with your partner as well.
Okay.
All right.
Dr. Carol.
To add a bit to it, as the lady grows, she goes through childbirth and she ages past 40, the hormones become imbalanced.
Okay.
Estrogen is down, so the pelvic structures, as in the muscle holding itself together, is not like it used to be.
Okay.
So certainly sometimes there will be few instances like this, but the couple can work around it by also position.
Okay.
By the form of foreplay and lubrication.
Okay.
And the woman might want to visit the toilet before
okay.
sexual intercourse,
Okay.
just to make sure that there is no wind releasing.
Okay.
She's embarrassed about it. But if she's growing, and because of that she's experiencing that, she shouldn't feel embarrassed.
Wow.
We have pelvic exercises she can do to strengthen the muscle, so that she may enjoy sex with her husband without feeling embarrassed. There's nothing embarrassing about sex if you are doing it right.
Wow.
All right. Interesting.
Wow.
Please keep your questions coming through. And we've had a lot of questions coming in relating to men. But I think, Mommy, we are going to be addressing these next week. We have a lot of them.
Next week, we'll be handling, a doctor will be coming in and they will handle issues pertaining to men. So when it comes to problems associated with sex, it's not just women alone. Men are also going through issues, early ejaculation, how do you call it? Impotency and all that.
Dysfunction.
So next week, a doctor will be coming in. Dr. Asante will be here with us. And then most likely, if Dr. Vanessa is also available, she will be here with us. So please, men, get all your questions. The things you can't talk about, please, send the questions to us without your name. And we will mention your name, and then we will answer you. Just today, I had an SOS message. A lady wants to divorce, and that she's been married for 7 years.
Wow.
And within 7 years, they've never performed.
Wow.
Within 7 years, they've never performed. Wow. My darling, next week will be your day. We will answer the questions pertaining to men. I wanted to bring him today, but I felt that there will be too many questions pertaining to women, so we'll have another day pertaining to men. So let your questions keep coming. We will address them next week.
Yes, and
I think
our time is long gone.
So we can take maybe
just one more
questions.
Yeah.
Oh, okay.
This question actually is a question we've dealt with sometime last year, but I want to believe this is a non-royal person who is watching Powerline TV for the first time and also joining Family Life series for the first time. This series currently, the Sexy Marriage, has been running for the past 4 weeks. So you can share the link with your spouse, get them to watch some of the episodes that they may have missed, and be a part of the success stories that other marriages are enjoying. But this one says, and the reason why I gave this intro, says, hello, Mommy, can your doctors kindly advise me? I'm planning to get married. Is sickle cell test necessary before marriage?
Dr. Carol.
And why?
Yes.
So we handled this over 2 or 3 weeks, but I believe the person might be listening to us for the first time.
Yes, I would say sickle cell disease test is very important before you do get married, because the transmission of the condition is genetic, and you're going to donate one side, your partner will donate another side. And the inheritance is 25% per each pregnancy or per each birth. So at every time you do get pregnant, the body will select 25%. And so you can have 4 children and they all have sickle cell disease. And in fact, it kills the joy out of the marriage, because what kind of marriage is it blessed by children where every time you are in hospital, you're spending money, some of them may not live to see 25 years, although we have medical interventions that have prolonged life. And also, your time together with each other will be taken away. Your ability to earn income to take care of the family will be taken away. So when you look at all the trouble that can come with it, I would say have a sickle cell disease test before you do get married. Yes, there is advancement in medicine now, where we have situations we can select which kind of embryo, that is, I'm talking about assisted reproduction here, where we can select which kind of embryos to put together to avoid such things.
Wow.
So if the couple are at a stage in life where affordability is not an issue,
affordability,
and the technique is available and accessible, then you can go all out.
Okay.
If you want to talk about faith, there have been situations where people have gone ahead against medical advice, they've gotten married, and they have not had sickle cell disease.
Wow.
So I'll leave it to your choice, but then I will say, from my medical point of view, do have a sickle cell disease test. We call it electrophoresis, in order to know your genotype and know that of your partner, and decide early which way you want to go. In addition to that, as part of the premarital counseling, we do other investigations as well against STIs like HIV, hepatitis B, and other inherited stuff. Thank you.
Are we okay?
Well, there's one that has come with a red flag. I don't know if you want us to read it. Says, good evening, Mama Rita.
Good evening.
My wife is 3 months old after delivery. The part of sex that we both enjoy is when I suck her breasts, and it enhances our foreplay and makes the sex time very beautiful. But now she's a lactating mother, and I can't suck them anymore. It is affecting our foreplay time. Please, what can I do?
This question
Mommy, over to you. Mommy, over to you.
Dr. Vanessa, I think this will be our last question.
Explore. So if you're, it's not the place to do at the moment, but try somewhere else. There'll be places that you haven't even thought of that you will enjoy.
I like
so
that.
Just enjoy up. And then, you know what? It'll be more exciting after having a long break from it. You'll enjoy it. It'll be sweeter in the months' time, in the many months' time. So, but whilst you're doing that, there's an opportunity to just get to know each other in a different way.
I hear these days the men are sharing the breast milk with the, with the babies.
That it gives them sexual potency. I saw one.
Yes, I
like
saw
that.
one
I don't
too.
know how true that is. And although we say the breast of your wife shall satisfy you all the days of your life, please, when she's lactating, give her a little break, and so the baby can also have the breast milk. As Dr. Vanessa said, explore.
Explore, my darling. So soon we have to bring today's program to a close. I have enjoyed Dr. Vanessa and I have enjoyed Dr. Carol. Shall we give them a... They will bring us their closer remarks. Certainly they are going to come back again. I have really enjoyed Dr. Carol. You are going to come back again. For Dr. Vanessa, this is the second time, and most likely you are going to come back with Dr. Asante next week for the men's talk. So, Dr. Carol, please give us your closing remarks, and trust me, you are going to come back, and I'm going to refer a lot of cases to you.
Yes, Mommy. Thank you very much, Mama Rita, and thank you for having me on the Family Life series. I really enjoyed myself, and I would say that the topic we discussed today is very important. Painful sex is real. Ladies, don't feel ashamed. You haven't done anything wrong. There is help. And so see the appropriate person, see your gynecologist for help, so that you'll be able to enjoy this wonderful thing God has given us as couples.
If for any reason you want a personal discussion with Dr. Carol, please send us a message and we will see how best we can link you with Dr. Carol. Dr. Vanessa, your closing remarks, please.
No, just thanking you, Mummy. Thanking you for bringing this topic out into the forefront, and it's great to meet Dr. Carol as well. I think that this is such an important topic, and women, you are important, you are special. You don't need to put yourself on the back burner and think that, I have to prioritize other things in life. You are important. So, and sex is important. And you enjoying sex is key to your relationship. So if you are having any trouble, again, don't be ashamed. Don't let fear take over. Really go and find a accredited doctor to go and work with you, support you. Don't suffer in silence. And also, just with couples, the key thing is, I said earlier, explore, enjoy one another, because that's what we're meant to do.
Thank you so much, Dr. Carol and Dr. Vanessa. And from us at Powerline TV, we want to say thank you for being with us again on your Wednesday evening. We will come back your way, same time, same day, next week. Until then, take very good care of yourself. Eat well, take a lot of water, have a lot of sleep, have a lot of fun, my darling.
And explore.
And explore. I like that. And explore. I'll see you again. Have a good night.
Powerline TV,